you guys will want us to stand and back up. Okay. What's that? Oh, got it. Okay. Well, I just don't know. Someone else set it up, so I want to make sure it's not ours. Yeah. But they can. It's. We'll probably all have people step.
Glad to hear that.
Is this good?
You might want to step in front of the mic.
Okay, no. So we do want to settle. Okay. Okay. That's what I wanted to make sure. Okay. Okay. Cool. Okay.
Does anyone in the press not have a copy of our directive yet? The one? Oh gosh, we're all gonna have to share. There are a lot of us who are working on it from outside the hospital.
Good afternoon. My name is Luis Sargueta. I'm the Communications Director at Unidos, Minnesota. And we are here meeting with a number of healthcare frontline workers as well as people that work here directly at HCMC. We're going to be talking about an incident that occurred on towards the end of the year, around the holidays. And to start us off and talk about what happened, we're going to have Representative Noor, who was on the scene outside that day.
Good afternoon. My name is Mahmoud Noor. I represent District 60B. So on that day, an individual who had medical conditions was taken from the community and then brought directly into the emergency room because of the condition that he was in. When someone of that status is grabbed by ICE, and that leads to a very serious situation. The ICE agents, 6 of them were involved in that process. They came inside the ED, they handcuffed the individual to the bed, that he was getting access to care, and that meant that he was distressed even further. So that created more harm than necessary. That created tension within the emergency room and within the hospital area. That created tension for the patients who were getting care in the hospital, for everyone who was within that area. Thereafter, that individual was admitted in the hospital. He was unhandcuffed, and we had some elected officials from Hennepin County who got involved in the process, brought their legal team and everyone else, the administrators, to make sure that those individuals who were rotating 2 agents every 4 hours to make sure that that individual is detained. Given that this is an individual with a high medical risk, that individual, if he was detained, he could have lost his life. So what we're talking about is respecting the rights of the individuals who are critical ill, those who are seeking services in this hospital when they need those services, regardless of who you are. If you need care, you should not be deterred because of ICE. This is a critical issue. It's about life and death. And this situation will have been really tragic if that individual didn't get the care that they needed in this hospital. So thank you.
Next up, we will have a representative from the Minnesota Nurses Association. She is a healthcare worker, Lex, and I'll have her introduce herself.
Good afternoon. My name is Lex Martin. I'm a registered nurse here at HCMC and a member of the Minnesota Nurses Association. Many of my colleagues and I condemn the lack of regard for patient safety and staff transparency in this situation. In light of these recent events in our hospital, we're asking Hennepin Healthcare to take immediate action to update and enforce our institution's policies regarding interactions with immigration enforcement. First and foremost, immigration officers should not be permitted under any circumstances in private clinical areas without a signed judicial warrant. Absent a complete and correct warrant, immigration officers should be accompanied immediately out of the facility by HHS security. Any action less than this violates patient safety laws, including HIPAA. Should immigration officers present such a warrant, the security department must diligently verify the identity of officers entering HCMC. With the exception of medical masks, we ask that HCMC enforce a policy of barring face coverings for law enforcement. Security must also carefully document these encounters, including officers' names, their badge numbers, the agencies they represent, the location on HHS property, and the times in and out of the facility. This documentation is consistent with our current written policy regarding interactions with law enforcement. That said, these interactions are not the same as others. In circumstances of detention by ICE, these persons are under administrative custody and not criminal. At present, our hospital policies do not differentiate these very different scenarios. They must be separated. It is cruel and it is unjust to apply policies and measures designed for those held on criminal charges to those who are not. As nurses at Hennepin Healthcare, our primary mission is to provide safe and excellent care to all patients and families, irrespective of their immigration status, their language, or their country of origin. When faced with situations that impede our ability to deliver care, we rely on the institution to provide clear directives as to how to respond. We implore HCMC to step up and implement policies that protect the safety and privacy for all our patients, families, and staff members. Thank you.
So all this information will be emailed afterwards with the same media list. We do have, in addition to the list, we have a representative from the American Pediatrics Association who will be introducing herself as well as Jana.
Hi there, my name is Dr. Jana Gewurtz-O'Brien. I am the president-elect of the Minnesota chapter of the American Academy of Pediatrics. We are here for the kids. Over the last several weeks, I have been working with babies who are newborn up until age 18 to 21, and I will tell you that there is a crisis among our Latina and Somali families. They are afraid to come into the hospital. We are seeing a rash of appendicitis that should have been treated earlier, but people have been delaying care because of fear that ICE is going to show up at the hospital. Families are, I'm going to say that again, families are afraid to come in to get life-saving necessary treatment because there is a sense of fear that has been perpetuated by our administration, and that we need hospitals to step up. We need institutions to step up. We need our city and we need our state to protect hospitals and healthcare setting and keep them safe spaces for healing, not places of fear. Being in a hospital is already traumatic enough. Having fear and a sense that they are unsafe or that their family members will be detained is completely unacceptable. We're here for the kids, we're here for everybody of all ages, and we're here for life at Hennepin. Let's stand by what we believe in.
Can you spell your names really quick?
Yes, it is Jana, J-A-N-N-A, last name Gewurtz-O'Brien, G-E-W-I-R-T-Z-O-B-R-I-E-N. Thank you.
Next up, we have an elected champion who is continually working on immigration and a good number of issues here in the state of Minnesota, Representative Leash Kozlowski.
Hey everybody, Leash Kozlowski. I use they, them pronouns. I represent the beautiful district of 8B, Duluth in Greater Minnesota, and I'm also here as a co-chair of the Minnesota Posse Caucus as well. And I'm here, and you might wonder why Duluthian is here, is because this is not isolated to the Twin Cities, to HCMC. We know from Duluth and Superior to Brainerd to Worthington to right here that our communities are under siege. And what is happening in a moment of intensified federal immigration enforcement across Minnesota, as we have seen an influx of hundreds of officers being deployed, and that scale matters, and that scale is increasingly adding fear and brutalizing our communities, and as we heard, preventing these places from being healing spaces that are vitally needed for our communities. Communities of color, immigrants, and refugees across the state need these places to remain safe spaces of healing. And we know that our collective resistance to ICE, to this immigration, the violent attacks on our communities must go beyond community-led responses. And I am so grateful to be here with healthcare workers who are organizing, union leaders. We've been working with elected officials across all levels, and we need us to step up and step in to make policy solutions that go well beyond just grassroots community solutions, and reinforce what the community is doing. So today we're here calling on HCMC as well as Minnesota hospital and healthcare providers to make the same brave choices that have been made in places like California and Illinois when ICE came showing up in their hospitals. They chose to protect patients as well as to protect their healthcare workers. So why this affects people beyond one hospital? Because when enforcement expands, we know that fear spreads. People, as we've heard, are delaying medical care, pulling kids out of school, avoiding workplaces, and disengaging from daily life. We know that the harm does not stop at immigrant families, that it affects public health, worker safety, education, and community stability statewide. And that's why preparation cannot be reactive. And there are steps and measures that we can take right now. Institutions must remember that any ICE presence in your facility, as was stated, puts community and patients at risk. And patients in ICE detention are under civil detention, not criminal custody, and must be treated accordingly. Our community members, when they come here with threat of ICE or are detained, you have to remember are very vulnerable, might not have access to interpretation, might not access daily living necessities or legal services. And so we're calling on you now to do the right thing before more wrongs are done to our communities. I want to make sure that folks know within the Fourth Amendment frame that every single person, no matter your status, has certain rights imbued upon you by this Constitution that follow you even into the halls of these hospitals. It protects us all from illegal search and seizure. That means mass federal agents do not have the right to enter these institutions without that signed judicial warrant. That protection applies to hospitals, schools, care facilities, businesses, faith communities, and workplaces. And so our institutions must do more now. Do not allow ICE on your premises without a valid signed judicial warrant. Train staff who are hungry for this. They want to know your rights and responsibilities during search and seizure operations. And put clear policies in place so frontline workers are not left making impossible decisions under pressure. So HCMC, so all of our hospital leaders, you can follow the lead of our communities of brave workers and electeds across the country. Make sure that care is protected here at HCMC in the suburbs and greater Minnesota. We can do this, and we're counting on you.
Thank you, Representative. Next up, we have representing St. Paul Federation of Educators, Leah Vandasser.
CMC, the staff is working to get a safety protocol in place. What happened here recently shows why. Every hospital needs a protocol for ICE. Every single workplace, every business, and every corporation, every institution needs a protocol to protect the constitutional rights of employees and patrons. The federal government is conducting illegal searches and seizures, and we need to be prepared. St. Paul educators have worked with the St. Paul Public Schools around a protocol already, and we've actually provided our members with that protocol right on a badge that goes right with their ID. They have it at their fingertips if needed in a crisis. This is not just a theory about a policy, it's a reality that we live in now. Protecting constitutional rights is not the job of any one community. It is the responsibility of every institution that serves the public. What we do now will determine if Minnesota can remain a place where people can live, work, learn, and seek care without fear. Thank you.
Our final speaker is a healthcare worker here from HCMC. We have, sorry.
In the last 8 months, Unidos Minnesota has trained over 300 frontline healers on specifically what to do if ICE enters the hospital or the clinic. Together, we have brainstormed responses, researched our legal obligations, and have most importantly created a network, a web of healers that work together when a patient, a community member, needs help. Our web, our connection to each other, is ultimately what enabled our response to remove ICE from their unlawful occupation of this facility. This is an invitation to the healthcare workers across Minnesota. Get trained, get organized, and protect your patients. The Unidos Healthcare Committee is hosting our next healthcare worker training on January 18th. These trainings give staff the tools to protect patient rights. You can find the sign up on the Unidos MN Instagram page. Come be a part of our network, our family, our community. This organizing is not limited to hospitals. Workers in other industries and employers are also stepping up to defend constitutional rights in their workplaces. When institutions put clear practices in place, workers are protected and communities are safer. Please attend our event through Minarka, Minnesota, January 14th to organize in all of our workplaces. The website is minarkamn.org. The closing is the most important part. I've saved the most important part for last. I want to speak to our patients, the reason why all of us are here. Can we get all the Latino press to the front? ¿Dónde está la prensa latina? ¿Hay alguien aquí? Sí, perfecto. Y sí, soy un gringo, pero yo puedo hablar español también. There are many more communities than the Latino community that are affected by what we are talking about today, but I only speak Spanish and English. Whether you are Latino, Hmong, Somali, Native, or any of my other neighbors in Minneapolis, I'm speaking to you too. I want to be very clear. La salud es un derecho importante. No podemos entregar nuestra salud para el miedo. Healthcare as a right that we cannot sacrifice. Si tiene dolor, I'm gonna wait. Si tiene dolor, if you are in pain, si está enferma, if you are sick, por favor, vaya al hospital. Please go to the hospital. Si su familia o niños tiene una cita o tiene que recibir vacunas. If your kids or family need to go to the clinic or need vaccines, por favor, vaya a la clínica. Please go to the clinic. Si usted tenga miedo, if you feel unsafe, por favor, llama la comunidad, sus políticos o organizaciones como nosotros. Please reach out to community, your politicians, or organizations like us. La comunidad está presente. Estamos arreglando estos sistemas. The community is here. We are fixing these systems. Nosotros vamos a continuar a ser presente para asegurar que se queden los hospitales lugares de sanar. Healers will keep showing up to make sure hospitals remain places of healing and not fear. Thank you.
We will now leave time for Q&A.
Can you kind of talk about how
We'll do one, and then I'll...
you're calling on the hospital to make changes to update its policies? Just give an idea of what the conversation's been like with hospital leaders. Has there been pushback? I mean, why aren't things where they need to be in your view?
Yes. So I'm going to have Jamie answer how updates of these conversations with the hospital. Questions.
We had met with county commissioners in early December and had an extremely productive meeting. We're incredibly grateful to the county commissioners. They've been present. They came here on a holiday to save the day. They instructed HCMC to meet with us in early December, and In our attempt to schedule a meeting, they asked to wait until after the holidays, and we have not heard anything back from them.
Can we kind of talk about how this all went down? It sounds like there was a confrontation, we were saying, with these ICE agents. Who was there and how did that kind of go down exactly?
Hi, I'm Representative Aisha Gomez. I represent District 62A, south side of Minneapolis. So I wasn't present, but what happened is, as our speakers said, we had ICE agents show up at this institution and without a properly signed judicial warrant from the last week. And that is the standard for entrance to a private space, whether you're in a home, in a workplace, in a hospital or clinic setting. And so they were allowed into the private spaces of the emergency department with the patient, and that was improper. It was always improper for them to be here because they did not have the legal justification to be in those private spaces. And so what happened is that our Hennepin County commissioners worked with leadership of the hospital, including the leadership of security, established that there was no judicial warrant, and told them that they had to leave, and they left. And so this is very important for anybody. If it's your home, if you are in charge of a business, if you work at a healthcare center, you can tell ICE agents to leave if they don't have a signed judicial warrant. Representative Noor has done this heroically at an apartment building. They will lie to you. ICE will lie. It's demonstrated. They will lie. They will act outside of the law. And so it's up to all of us to know our rights in these times because, we have to assert them or they will be trampled on.
It sounded like earlier. I need help.
Oh, shit. Hey, can we call an ambulance? Call an ambulance.
Yeah, I'm calling 911 now.
Perfect. We got so many doctors here.
I know, it's like...
Hi, I'm at the corner of Chicago.
Can we turn cameras off? Turn cameras off, please. And point them that way, please, okay?
If you can give us just a minute to reset, and then thank you for turning cameras off. Water check, hydration check, before we turn cameras back on.
I know this woman had a follow-up.
Four cameras turn. We'll take another 3-4 questions just because we got to
I know you had a follow-up.
Yeah, we'll do the follow-up. Perfect.
I can't say whether or not I can't say whether they showed up with the with ICE agents because I wasn't present. What we do know is that there was no signed judicial warrant, and so Representative Noor talked about the fact that this man was taken from his care facility. So at that point, there was no signed judicial warrant for this man, and so because an immigration proceeding is a civil matter, it should not be treated the same as a criminal matter. Whether or not he came in or the individual came in with ICE or without ICE, there was no warrant. And so that's the important thing, I think, is that without a signed judicial warrant for an individual, there's no legal kind of right to detain somebody like that.
Is this individual still in the hospital then? Are they back home or?
I don't think we should.
No.
Yeah, I don't think we need to talk about that.
In respect to the story here is clear protocols and not the patient's record or what their illness was.
Did anyone see what
I was gonna say, I'll go here then.
Considering that ICE did not have a proper judicial warrant, how were they able to make their way inside a patient triage? And my follow-up would be, are you confident that HCMC allowing them in there, that they didn't violate their own handbook protocols?
We have Jamie. Jamie, can you answer? I'm gonna have it repeat.
Jamie's eating a cookie. Doesn't that sound like a question for the leadership of the hospital? I mean, that would be
That
my.
does. Not
you
really,
know.
truly.
What's the question?
Okay, so how were our agencies able to make their way to the patient triage? Considering HCMC let them in without a judicial warrant, can you guarantee that that hospital's not liable for violating warrant?
I think like your question is exactly what raises our alarm bells as like a organization that protects people's constitutional rights and follows federal law. I think the beginning of this incident still blurry for us. We've worked very hard to validate and verify all the other things we've been telling you, but we've chosen to not include details about that aspect because we have not been able to verify it in a way that would make us comfortable.
Can the folks at Patios give us a little bit of a general situational update on where things stand with ICE arrests in Minnesota over the past couple days during this more recent surge?
Yes. I think the number that everyone continues to hear is 2,000. And I think it's important to just let it be stated that there were already a number of agents that were already brought into the state last month. So we already had 700 federal agents that have stormed our state. We're talking actually nearly, do the math, 700 plus 2,000, we're talking nearly 3,000 agents that are roaming our state and feeling confident enough to enter a county hospital.
Do you know of any other incidents in which ICE agents have been able to access?
Already, just even hospitals that Unidos Minnesota has heard, not us, no. But there's been plenty of incidents already, just even today, St. Paul and Minneapolis.
Can someone who was there on the day the patient was here tell us what they saw?
Yes. We're gonna not be able.
We're
Yeah.
not keep it about the patient.
Yeah.
Keep it what you said.
We do.
Yeah.
Okay. Thank you all so much. We really appreciate your time. Thank you. Yes, got my number.
All right, that's fine. You got it. Cool. Thanks so much.